Awesome. Hello, everyone, and welcome to our live session today. I will be going over a quick startup presentation to welcome you all and introduce you to our program and the various opportunities if you have not previously attended our shadowing sessions. So here we have a little poll that you can answer just so we know, we can read the room and see how our students are doing in terms of their education and their experiences. But we have various opportunities in pre-health shadowing, so I'd like to introduce them to you. If you haven't been to our sessions yet, pre-health shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. And my name is Muntaha. I am the editor-in-chief here at Pre-Health Shadowing. Thank you so much for attending today, and let's get started. So just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you need assistance enabling the transcript, please direct message us using the Zoom chat. You can direct message me or one of my team members, and we are always looking for ways to be more inclusive and making sure that everyone has access to our sessions. So if you have any recommendations, you can email us at the email on the screen, info@prehealthshadowing.com. So since this is an international program, we do want to know where our students are Zooming from today. You can drop it in the chat. I'm actually calling from Florida. And let's see, we have a lot of students from the United States, which is really cool. Awesome. If you want to stay in the loop and follow us on social media, we are active on Instagram and TikTok, and you can sign up for our email list and on our website to never miss a session. We have some wonderful opportunities for you all as benefits of being part of our program. So if you are looking to get research experience, did you drop the ball on applications this year because of the pandemic? I am excited to announce that Pre-Health Shadowing is launching a research program that will allow students to connect with principal investigators as they conduct research in a plethora of topics, fields, and locations. This program is 100% remote, which means that you have the power to connect with anyone from around the world. And this is an 8-week program that will begin on June 21st. So for more information, please fill out the interest form, which is sent in the chat below, and we will get back to you on any questions you have. And regarding the interest form, we'll get back to you as soon as possible with additional details about the program. We have partnered with Kaplan to get our students a 10% discount code that can be used on Kaplan products as well as free resources. So this is for like study guides to help you prepare for standardized tests like the GRE, the MCAT, the NCLEX, or PCAT. If you fill out our short survey in the chat, we will get you signed up for these deals for free. We would also like to draw your attention to another amazing program called Neolith. Neolith is an online mental health platform for students and for pre-health professionals especially. So if you'd like to sign up using our code, you'll be able to have access to their free mental health platform and all of their resources there regarding mental health. You'll also be able to get a psychology internship or their certificate opportunities at Neolith. Additionally, we are really excited to announce that we also have a partnership with Krispy Kreme for you to purchase one delicious dozen donuts to enjoy with your loved ones. With a donation of $10 to PHS, you will be able to have a free dozen donuts. And for more information and instructions, they can be found with the link in the chat. We also got our PHS merchandise. This is another way to help our organization and acquire a really nice piece of clothing. We have our t-shirts and our long sleeves or our hoodies to represent PHS and our mission. So if you'd like to purchase one, visit the link in the chat. Mask for Mask is another partnership we have. It's an amazing women-led organization. They donate 4 masks for every 4 masks sold. This goes to people in need during the COVID pandemic, like those in the homeless community, healthcare workers without proper PPE, and others who are just struggling to stay safe during our pandemic. So with our discount code PHS15, you can get 15% off your order. If you buy through this method, Pre-Health Shadowing also gets 10% off. So you're able to donate to those in need who need masks, and also a nonprofit. So it's a really good deal. If you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers and our team members. You can apply to be part of our administrative team and lead students in various projects and initiatives with professional outreach, grant writing, and more. We understand that as a pre-health student, you may not have the time, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. So you can click the link in the chat to either become a synchronous volunteer or a team member. If you are a high school student, we have a program called HTP, which means High School Training for PHS. This allows you to connect with college pre-health programs, get involved with fundraising for PHS, and organize resources for other high school students interested in medicine through pre-health shadowing. We want to recognize the hard work of all of our students in our program, so if you are interested in getting published and you have a knack for writing, please visit the link in the chat and you can submit essays, reflections, research papers, and reviews to our editor-in-chief. I'm the editor-in-chief and I really look forward to reading your submissions. You can also reflect on live sessions or this live session if you'd like to. So in the link in the chat, you can submit your writing. So as part of our mission at PHS to promote diversity, we have launched an initiative to have our monthly panels to celebrate different demographics in the field of medicine. So some of these upcoming events include a series of patient experiences and the COVID-19 Roundtable and International Student Forum. So if you have a mentor, professor, or professional that has inspired you and you think they could contribute to these conversations, you can nominate them today using the link in the chat. And we humbly ask that if you are able to, you can donate to our program. As you know, pre-health shadowing is completely student run. We are a nonprofit that's working around the clock to keep these services free and accessible to everyone. And our Zoom and our website are not free, unfortunately. So if you have any contribution you can make and are financially able to, we request that you send this link to others that you know are able to donate and to yourself so you can keep this service running. Throughout the session today, we encourage you to drop any questions you have for the speaker in the chat. Our team members will be making note of these so we can ask them in the latter half of our presentation of our live session. And also I'd like to remind students that in the latter half of the Q&A, if you'd want to unmute, you can always raise your hand and ask questions directly to the speaker. Make sure to take good notes as our professional is going over their presentation, as there will be the chance to take a post-shadowing assessment to verify your virtual shadowing hours. More information on how to take this assessment will be in the end of the session, so please stay tuned. Lastly, if we can, we request everyone to turn your cameras on. This is by no means an obligation, but if you are able to, it just makes us feel a little closer during a time where we have to socially distance. So if you are able to, please turn your cameras on. We also request that you make sure to mute yourself because we don't want to disturb the session, and we want to ensure that the professional has our complete and full attention from the audience. And also, I appreciate everyone for listening to my startup presentation. Now, I would like to welcome our professional, Dr. Aldroubi, and thank you so much for coming. And even when it's 3:30 a.m. at your country, you may share your screen whenever you're ready.
Hi guys, how are you? I'm really honored that I am with you guys today. I hope that my presentation will be helpful. So now I'll be sharing my screen with you guys. I hope everyone can see it.
Yes, we can see it. Thank you.
Great. Okay. So first of all, I just wanted to go through a very quick definition or explanation. Why did I even choose medicine in the first place? So basically, definition of medicine is to help people to improve their health. From my point of view, medicine is not only that, but it's the act of help. So it's not only about you helping them healthily, how to become more healthy and more having better lifestyle, but even a slightest help out there in the world, helping an old lady to cross the street, helping a disabled child to reach better education, it's kind of medicine. So this is my personal definition of medicine. So a lot of people might have different reasons why do they want to go through medicines. Maybe the love of help or love of giving and non-stopably. Maybe even they want to be always in the place where they are learning new stuff and how to improve other people's life. Maybe they want to do this because they want to see the thankful look in the people that they help. I personally believe that one of the biggest reasons that all of us seek medicine is not only the help, but the rush and the um, euphoria we get after we approve or we approach a better health for someone out there. Excuse my delayed speech, but I've been awake since early morning and I'm really tired, so really sorry. Anyway, so this is why is medicine important for everyone and why is it important for me personally. So as the title of the lecture explained, pediatrics. I am not a pediatrician by myself, but I'm someone who's really doing their best to reach a better place with pediatrics, to become a pediatrician and improve the overall of health of children's out there. I have a specific interest in child abuse and child harassments. And I have been doing a lot of outside workshops with different teachers, especially that now there is a new perspective in pediatrics where you can use psychodrama or psychotherapy to help children reach better outcomes after an abusive state. These type of courses are not only for pediatricians, but they are for teachers, law enforcement, lawyers, doctors, family medicines, and a lot of nurses, even anyone who can be direct in touch with children who go through abusive state. Okay, now why is pediatrics important? Personally, I believe pediatrics is important because you're not only dealing with one patient, but you deal with two patients. You're dealing with the child and their families. So when you do that, you have to have a better understanding that all the families out there, in generally speaking, wants the best for their kids, but they don't know the best always. So sometimes you have to fight for this child, to stand up for them and actually show the family what is actually the best for that child. Now, what's very nice about pediatrics that in the contrary to any other type of medicine, it's never the patient's fault. So how it is. And for example, internal medicine, when we deal with diabetes with a child or with an elderly. So diabetes in child, whether it's a type 1 or type 2, they are both caused by either genetic mutations like in the diabetes type 1 or caused by family negligence through unhealthy feeding lifestyle of the baby. When you look at an elderly and the otherwise, adults usually tend to do stuff that hurts their health and expecting that okay, all of us know that coffee can cause ulcer, for example, but we go and we still drink it. Someone with diabetes type 2 would know that eating a lot of sugar will help them, but they will still go and eat it. I'm not saying that these people deserve what they get. No, of course not. But what I'm saying is children usually do not have the power to control the situation they are in. Something else, kids are really sweet to be around. Sick, healthy or not, they are really sweet to be around. And as an only child, I really love them and I really go along with them. So I love being around child. Something else, they rapidly evolve. So a case of a medicine, the case of pediatrics, that it's a department that cover a lot of branches and that makes it easy for it to go in new levels daily. You can explore new stuff, you can do new researches, you can find out new conditions, new treatments, new methods of approaching cases even. If we're talking about abuse, for example, a couple of years ago, we would not know how to deal with that. But now we have actually societies full of doctors who know how to deal with that actually. And this is something very amazing about pediatrics, that's always evolving and it's always developing. Something else is that kids, as I said, really need someone to speak up for them. So although the family know the best, wants the best for kids, they do not always know what is the best. This is our duty as physicians, as pediatricians, to do that, to help these children to be heard, especially that the group of children is like the group that pediatrics cover. It gets evolved and increased by year. And in the beginning, it was only from 0 to 12. Now it's from 0 to 20 in US, for example. So pediatrician deals with all of that. And this is a really wide range of age that can cover a lot of problem, including sexuality, including mental development, including even normal body development, self-hygiene, self-care. These things are always they always need someone to speak up for the kids in different situations. And finally, why pediatrics? Basically, because we love kids. That's why. If you love kids, you have to go for pediatrics. It's an easy, simple way. I know pediatrics is not one of the best paid in US, for example, but it's a quite good branch because it really shape a future of a human being, and this means shaping the future of a whole generation. So I wanted to share this interesting case. There's something nice about pediatrics that you can do a simple act, and this simple act can change you into a hero of the day. So I was in Germany doing an internship, and I was only my 3rd year, which was like really big deal for me, being in Germany and being alone for the first time with friends and everything. And I was in the pediatrics department where we met a boy who was 17 years old. He was a male Iraqi child. He was a refugee in Germany, but unfortunately he came to Germany alone without his family nor his girlfriend. And that caused a lot of trouble for him. He used to come to ER frequently with seizures and different type of stuff. And even when we do an EKG, we can see that these seizures are pseudo seizures. They are not normal. They are not actual seizures. So a psychiatrist consult actually told them that this kid need to be treated psychologically and helped. And since he does not speak the language, it was really hard actually to find a psychologist or a psychiatrist in Germany who speaks Arabic. So I went in, and they finally found him one, and I went in, and they were like, you know, Nesrin, we have tried everything. So you know what, you know the language, try it. What would happen? And I went in, and we were alone, and I spoke to the guy, and I was like only a few years older than him. And I told him that I spoke some stuff. I can't really address it now since like the doctor-patient sorry, doctor-patient privacy. So I talked to him, and then with it, like after 5 minutes speaking to him with his own language and like reassuring him, I was able to actually convince him to go and get the therapy. Of course, it's not always that simple, but a simple act of a speak with that kid was enough to make me feel like a hero for the rest of my life. Okay, so now away from pediatrics, I just wanted to go through a little bit information about myself. I'm a 25 years old general practitioner who works in I'm a Turkish Syrian, so I do my obligatory services in a hospital here in Istanbul. It's called Shishli Itfal, which basically means Shishli Pediatrics, but it's not. I do not do my obligatory service in pediatrics. I do it in general practitioner in emergency department. So how did it all start? Like why? How did it all start for me to get into medicine? I was 4 years old when I started to say that I wanted to be a doctor. When I was a little girl, that was really big deal for my family. They were like, "Oh my gosh, she wants to be a doctor." They took me, they bought me the bag of doctor's tools and stuff, and it was the little child of the family. And they were like, everyone who used to see me, they were like, "Oh my God, this is our doctor. Oh my God, this is our doctor." things were not really the same when I become 18. When I was like 17 years old and I graduated high school and now I want to go to medicine, things were not really the same. My dad, my mom were very supportive, God bless them, but society was not. Society deals with Arab girls, and especially hijabi one, as that no, you're a girl, you should not go to medicine. You are a girl. If you go to medicine, then how would you end up being married? Who would look out for your kids? And I was like really shocked to see that. Like, what really was the difference between the 4-year-old girl that you were supporting and the 17-year-old girl that you are unsupporting now or de-support now? You're taking all the excitement that I had for the brunch. But anyway, I pushed myself and I was like, no, I want medicine. I'm going for medicine. And I went to Turkey. Why did I choose Turkey? First of all, I'm Turkish, half Turkish, so it would be easier for me to be there. I am raised in Saudi Arabia, so it's really hard for internationals to study medicine in Saudi Arabia. So I had to come here. Since I would be studying in private school in both countries, but private schools in Turkey are better high qualities than Saudi Arabia. I came here and I'm graduated from Bahçeşehir University. I am the first set of students that Bahçeşehir ever got. So we were like the small chickens and rats that they were like torturing around and kicking us. Yeah, it was like ugly, like the only word I can think about. Anyway, things went like not the really perfect, since system was really different from my high school. The language was different, the teacher were different, everything was different. And that's what I want to speak about now. I want to speak about the difference between the first few years and the last years of medicine. So the first 2 years of medicine are basically, they all depends on your basic science, chemistry, physics, and stuff like that in Turkey. And they are really interesting, but they are not, to be honest. We all love them because it's like we feel like it is medicine. But when we actually go to the years later on, like fifth and sixth, we realize that they weren't really medicine. They were only putting us in the shape to become doctors. There is one advice that everyone used to tell me. There's like, please pass your first 2 years and then ignore and you'll forget about them. And actually, that was one of the worst advices anyone can get, because your knowledge in the first 2 years are one of the most necessary and essential knowledge you can get forever. Because although there are really minor details in that years, but they help a lot later on in clinics. Like you see in these pictures, they were like, we were really devastated. We're like sleeping everywhere in the school. This picture here, it was like few hours before our exam. We have this system that's called community system, not community, committee system, where we actually examine all our subjects in one exam, 100 questions. And we get this exam 8 times a year, and then we get one final for the whole years with 200 questions. So, and there was no one before us to ask them how this system works or anything like that. Things were really, really tough. So yeah, we used to spend a lot of time in school trying to make up for things, or even like we go to school from 8 to 5, go home and then study again from God knows when to like 3, 4 a.m. That's why we really were like sleep deprived. We were tired. We were like exhausted all the time. But well, things do not last the same forever. It's either we grow up tougher and we get used to it, or things really do get easy. I'm not sure, but I would tend that it's the first, since God, yes, there was an evolve in our faces and we become more like a human being in the last years. And we started to have more of a medicine where we start to see pediatrics, we started to see neurosurgery, pediatric surgery, emergency department. And things were really exciting till, of course, COVID started, and things were like really different after that. But really, last year's are the real deals. They are not easy. You just get used to the being tired all the time, and then you start to know how to adjust your system. And here I want to make an advice for every pre-health student with us. Guys, I know the process might seem really exhausting and really tiring, but to be honest, it's really necessary for you to have time off, meaning to have time for you to take a break, for you to do something you love every once in a while, go out, enjoy your time. Do not let yourself drown in the idea of studying to the part you forget yourself, because that would cause really big problem called burnout. And burnout is one of the biggest problem we face as medical and nursing and pharmacy and dentistry student. We go so much into study that we forget that we're human and we need to relax and take time off and enjoy our time. So in my first 2 years, I did not skip not even one day. I didn't skip a class, even when I was sick. And that was like good, yeah, but it was tiring. In third year, I had a really bad exam. I went out to do some sport to relax myself. Unfortunately, I got a back injury and I got a vertebral herniation that caused me to stay in bed for 2 whole weeks. This really taught me that no, we really need time off. We really need time to give our body the relaxation they need. So speaking about the last few years, I want to share with you my first night shift when I started to get the real night shift, the real deal. It was in emergency department, and in my hospital, emergency as an interns, we do not do a specific thing of emergency department. We take the whole thing, like the red areas, the green area, the green areas or the yellow ones. So we get everything from a simple UTI to very complicated ambulance travel for someone who had a heart attack, for example. And although I am graduated from a private school, which they have a private hospital, but still we had really a lot of patients, and this gave me a lot and really a lot of experience. Now when I started working, I realized that no, actually that was tiring at the time, but now when I'm in emergency department, it's easier for me to actually use the knowledge I have set rather than go and learn it in the first place. My first night shift was terrifying since my doctor left me and he was like, you know what, I'm sleeping, peace out. And he went and he slept for like 3 or 4 hours and he left me. And then there was like this case where a guy came in and he was screaming out of pain. Apparently he had a kidney stone, and we gave him parole, which is paracetamol, did not work. We gave him tramadol for the first time, did not work. We gave him tramadol for the second time for it to work. And it was really terrifying since the doctor was like, you should not knock the door on me, you should not wake me up. And then I sent me and one of the nurses, we sat and we talked. And there I learned something very big, that nurses in a lot of times, they know way more better than us. So you really have to go ahead and listen to them, because a lot of the time they would be a life saving for you, especially in night shifts. They know a lot of these people. They are really under accredited and they really, really know a lot. They know more than us. Now I really want to talk about one bad side of medicine, because I know a lot of people will be like, oh my gosh, she speaks about medicine as if it's the pink world. Well, that's how I see it, duh. But generally, I want to speak about the idea of death. When I was in my emergency department, I lost my first patient, and she wasn't an elderly, she was actually young. She was 52 years old. She came in with an ambulance where she passed out around 20 minutes in her house before anyone to came in and see her and realized that she passed out. They spent 20 minutes in the ambulance trying to resuscitate her. Then they brought her to the hospital. We spent 40 more minutes. She was, we usually do not do this long CPR, but because the lady was young, so we were like, is she worth a shot? She was really overweight. She was 140, I guess, kilogram. And she's very young, but she has heart problems. She has diabetes mellitus. She has hypertension and a lot of things. That was really life-wrecking for me, since it was like my first patient that I lost. I really do not forget the moment, and I really do not forget the reaction of the family, especially that one of the guys of the family lost his mind and he actually hit his friend, his cousin. But anyway, it's a very hard experience. Unfortunately, we will all go through it. We will not save everyone, and we have to be ready for it. It's hard, it's tough, but it really strengthens us after that. It gives us the, when we save the next patient, we realize how valuable we can be in some moment, and how clueless and tired we can be in other moments. Okay, away from medicine. Does, as I said, you have to make time for yourself. So does really when you study medicine, you do not do anything else? Nope. Ladies and gentlemen, since I started medicine, my dad works in a job where he has to travel a lot, but so I would take any single moment where I have a 5-minute break and travel with him wherever. Since I started medicine, I visited New York, I visited London twice, I visited Berlin, I visited Venetia, I visited Rome, I visited Milan. I visited a lot of places. I even took a course in Leverkusen in Germany, and that was like a travel by myself and my friends, and it was amazing trip. I traveled to London once by myself, and it was like a really excited thing, since I was like the only child who never leaves family's house to someone who travels alone to a city like London. Duh, it was like scary, but it was really exciting. So why I'm saying, I'm not bragging, guys. I'm just saying that medicine actually a place where really gives you a lot of chances to travel and do a lot of things if you just know how to manage your time correctly. Now I practice kickboxing, for example. A while ago I was practicing yoga. And yeah, if you know how to manage your time, you really, really can do a lot of things with medicine. Stuff that I really was into doing was conferences. I always tend to organize conferences in within my school. And since I speak Arabic and English and Turkish, I was really honored to meet someone like Dr. Al-Mufti, which he's a very famous neurosurgeon from Oxford, sorry, from Harvard, and he's a chairman now there. I was really, really honored to meet him, and I spent like few days with him as an assistant here in Istanbul. I spent time even with with the very famous doctor in Alicante. His name is Jorge Elio. He's one of the famous ophthalmological surgeons in the world. And I really always tend to make sure to do as much internships as possible, since I'm not a person who is good with researches. So I really tended to make my CV stronger within organizing meetings with the school, or organizing going out on internships, even if they're gonna not be accounted by my school. So for example, this picture down here, it's from a conference we made in our school with biomedical engineering group, and the help of the Royal Academy of oh my god, I'm so sleepy. Yeah, the Royal Academy of the Internet of the Science International Trust, with Her Highness Princess Nesrin Al Hashimite, where we had a lot of people helping us from around the world, and it was a very great honor for us. Yes, one more thing I tend to make sure to do is my blog and my YouTube channel. I always feel like they're a very nice distracting thing that makes my mind out of the study mood, but within the study mood. So every time I get a nice recommendation or nice feedback from any student who I help, whether studying USMLE or I answer their questions about anything related to medicine, I really, really feel proud. And that makes me feel like I'm doing something within the medicine, although it's not medicine itself. Thank you very much for your attention. I hope I didn't spend a lot of time and I didn't give you a headache. And yeah, thank you very much for the opportunity.
Okay, wonderful. Could you please stop presenting your slides?
Yeah, sure. Okay. Don't, wait a minute. I'm trying to stop sharing. Did it stop? No.
No, it didn't. Don't worry.
Yeah, now it did, right?
Yes, yes, we're
Good.
good. We're good.
Good, good. I feel like I'm 70-year-old woman. Okay, whatever.
Don't worry about it. Okay, so now we can begin with the Q&A. So the first question that we have over here is, I think this one's a very interesting one. Do you have any ideas of how practicing medicine might change in the future?
You mean from my point of view or generally
Yes.
speaking?
Do you,
Okay.
do you have any idea of how it might change?
Well, I'm not sure if it's gonna change this way, but this is my wishing. Like, this is what I wish for. I wish to see more equality in the perspective of dealing with women in medicine. Since I am half Arab, half Turkish, I am hijabi, and I am counted for a lot of people as foreigner in this country. There is a very big gap in the idea how we look at hijabi women within the hospital's world. If they are hijab, if they are women, they are 50% they are not doctors. But if they are hijabi women, there are 20% chance that they are actually doctors. So this is a really big deal. Like, it was very heartbreaking for me. Like, I was in emergency medicine wearing a t-shirt saying like, keep calm, I'm your doctor, for people to actually realize that I am the doctor. It was really devastating. I really hate this idea. I hate the idea that we are still dealing the inequality of salaries between male and females and even chances. This is really something I hate. Plus, I would wish to see in the very soon future that we get rid of racism within the medicine. The other day, I was hearing a broadcast on something called Pediatricians on Call, and they were saying that actually, even we think that pediatricians are the sweetest hearts on the earth, but even within pediatrics itself, the patients of pediatrics, there's a study that showed that the chance of white non-Hispanic children to be prescribed antibiotics in ER is higher than Hispanic patients. So even within treatment, we have this problem of racism. It's like, oh my God, you're not white man, so I'm not going to treat you well. Or like in this case, they tend to do better by giving the antibiotic, but basically they did more harm. But anyway, it's still like not giving the antibiotic was harmful for the non-Hispanics, the Hispanics, and giving it was harmful for the white people. So God, please, let's stop racism.
Yeah, I completely agree. As a Hispanic myself, I do believe there's a lot of reformation that we need to do in the healthcare setting. So thank you for that comment. Um, so was there a role model, I'm sorry, in your life you revered and motivated you to pursue your profession? And what kind of qualities do you suggest indicate a good mentor or model?
Okay. First of all, I don't really believe in one role model. This is something I do really believe in. So you do not have to have one role model. You can have one for a different type of perspective of your life. So for example, when I was a kid, there is a really famous forensic anthropologist called Kathy Rex. She's actually the one who wrote and edited the TV Fox series Bones. She was my role model, to be honest. She was one of the reasons I really wanted, like, I wanted to go to medicine since I was 4, but when I was like in 6th grade to 7th grade, I was like in a gap. Should I not do medicine, do something else? And this is something really important for me, because when I started to see the show, I realized how, oh my God, can a female be strong and scientific? And she actually, one of the reasons she pushed me to become a doctor. When I started to become a doctor, like in the med study, in first year, she was my histology teacher. And I really loved her because she had this really nice perspective about doctors being the society stars. So she wouldn't even take us into oral exams or clinical exams without being men shaved and well dressed and female makeup on and dressed well, and having a shower before the night of the exam, where we all know how hard it is to do before the exam. so I really appreciate that from her. Plus, I appreciated how much she was available for me. How much she, in that time I started to have my beginning phases of my severe anxiety disorder. I started to have my panic attacks and stuff, and she was really helpful even when I had my panic attack before the written, like before the practical exam of histology. See, she was quite a help for me. So I really appreciated how much she was open up for me. Even when she left the school, actually we still go on contact and we speak. So if you ask me what is my point of view in a role model, it would be not them being soft and kind and stuff, but being helpful and supportive and professional. So when they are professional, they might not be the people who know, like I have this cardiologist. She's now my role model. She's a pediatrician cardiologist. She's not the one who would you go into the exam and she would give you the answer. She's really tough in exams. She's really tough in explanation. But when it comes to patients, she's very sweet. And when it comes for advices, she's always there for you. That's what makes her a good role model. It's not about how much researchers they approve for you. It's not about how much stuff like that they approve. It's about how much support they give.
For sure. Thank you so much. I'm sorry if you guys can hear the rain. It's raining a lot over here. Um, okay, so the next question is, what is the most rewarding thing you've experienced so far as a general practitioner and pediatrician? And what has been the most challenging thing?
Let me see. The most rewarding thing I would be so far, it would be the idea. Since I was the first class to graduate, like the first set to graduate from my school, we always thought that our school did not teach us well. I just want to address one thing. Our school now, although it's private, it's one of the top 700 schools around the world of medicines, which is not really something to see a lot with private schools. So although this was like 2 years ago, so I'm not sure now about the ranking. Maybe it's a little bit more, a little bit lower. I'm not sure. But anyway, but we were like so scared that they did not teach us well. You know, we graduate with the idea, all of us, we graduate with the idea that we do not know. We know nothing. That's how we feel all the time. But when I started actually Saturday was my first time where I started to work in this new hospital I am at. And there was a girl who's the same age as me, and we're both doing the same job. And the first week of the job is where you sit next to an old general practitioner and you actually learn the system. And then over there, I realized how much our school actually taught us. Although we did not realize it, but it's there. It's somewhere around here. Like we do not realize that while studying for USMLE, but when you study for you, when you actually practice, it's way different. So I guess this is one of the most rewarding moments in my whole life. What's the most challenging would be the idea of the when I came back from Germany, I'm someone really into plans and like things being organized and stuff. And Germany is one of the best countries to find this. They are very organized in terms of hospitals. It's like perfectly organized. When I came back from Germany to Turkey, I got a cultural shock, and that shock really, really hurt me for like a while. I got into a depression. One more thing really was challenging, the idea that my friends from outside the medical career do not really understand what's going on. They do not get it. Really, they don't. Not even your family, they don't. They think they do. And I appreciate they try, but they don't.
Okay, thank you so much for that like insightful comment. I believe there's a lot to think about when, considering the most rewarding things and the most challenging things when you get into a profession in the healthcare field. Um, so was there anything you didn't expect when going into pediatrics and general practitioner?
One more fixation of the concept, I still did not do pediatrics, just to be aware of it. Something I didn't expect when I started to do my general practitioner. I think I would still wait to see that. I'm not sure. I still did not like really. Yeah, there is one thing. The amount of paperwork I did, it was too much. I don't get it. Why did they ask for my like ID number 700 times? What do they want with it? Like, they asked for 10 pictures, and then when they wanted us to make the ID card, they asked for one more. Like, I don't get it. Why do you want all of these pictures? Like, why? I'm the same one. I don't get it. Like, it was so much.
Okay. So there's one thing you need to consider, like to the members of our audience, there's a lot of paperwork.
Yeah, yes, definitely. Yes. Yeah, and one more thing, do not believe your school when they tell you that your diploma is not ready, because it's most probably is.
Okay.
Yeah.
Okay, so some members of our audience are asking, how did you stand out in your applications for undergrad and med school and for your internship, I'm sorry. How do you stand
Okay.
out?
Okay. For medical applications, for like medical schools application, it wasn't that a lot of like expanding, because I just wanted Turkey. So it was like only going apply for private schools in Turkey, since governmental schools need a private and like specific conditions. I did not want to go through them. So there wasn't a lot, and they do not ask a lot. Like when I applied in 2014, they did not ask for a lot of stuff, fancy stuff. They only asked for my high school numbers, and they were like very high, obviously. But and they asked for my national exam, which is in Saudi Arabia, we did, and it was high as well. So yeah, I did not face a lot of problems fitting, like getting accepted here in Turkey. How did I do my internships applications? It would be networks. So do as much networking as you can. A lot of your internship you do not get through your school. You do not get uh you don't get it through, like, I don't know, online applications. You get it through your people. Like, how did I end up meeting Professor Jorge Elio? I mean, if anyone can Google it now, would see how famous this man is. He's like a god in ophthalmology. And how did I end up meeting him? My dad has a very severe eye problems, and he traveled the world looking for treatment for it. And finally, he found something in this clinic. We went there together, and I was like still in my third year, and we started to talk and stuff. And by the end of my fifth year, I applied there, and I went there. And when I went there, I realized there wasn't any students. There was like all of them graduated ophthalmological specialists. And I realized that they do not accept student at all. They accept me because I had a relationship with him. So your networks means the world for you. Like, a lot of people used to make fun of me how much I go and talk to student teachers and professors, but it's actually life-saving, like really life-saving.
Okay, definitely great advice. Really, you guys really need to work on your networking. So that's wonderful. Thank you so much for that.
You're
Um,
welcome.
so what advice do you have for those of the audience members who are studying for the MCAT and working on applications and are feeling very overwhelmed because the process is indeed very overwhelming?
Yeah. I didn't work on MCAT, so I cannot give advice for that in specific. But I can give an advice on the topic of overwhelming. The whole society of medicine, starting from the day you start to apply for undergrad to the day you become a professor or associate professor in God knows what hospital, you will be always in the chance of getting overwhelmed. It's part of the process. It is always there. The only thing you have to think about is whatever you're overwhelmed about now, in few days ago and a few days later, maybe a few months, maybe a year later, it wouldn't be matter. The amount of stress we gave for our first year grades was incredible. Our passing mark in my school is 70. All other Turkish school pass people at 60s and 50s. So what was A for other people, it was minus D for us sometimes. So yeah, it was really hard. And now when I think about it, I'll be like, why did I do that? Why did I overwhelm myself? Man, no one really asked me how much did I get in my second block. No one knows. No one cares. The only one who knows how many times I failed gynecology, it's me. And I'm the only one who knows I failed it because God knows the professor did not like me. So yeah, do not, I know it's an overwhelming process. I know my words now might seem not really accurate, but trust me, within like few months, maybe a year, maybe 2 years from now, this would not matter. But what would really matter over there is your mental health. So even if it would need for you to go and get professional support from a psychologist or psychiatrist, go do it. Doesn't matter. It doesn't matter if people will tell you, oh my God, I know some of the Western society would be like, oh my God, you're going for a psych? Doctors of crazy people? I know that because I am from that society, but that does not mean it's accurate. Your mental health is the only thing that matters. So take a break, take a breath. If you one day feel like you need to sleep it off, sleep it off. It's okay. The only thing will last is your mental health. Do not do that yourself.
Thank you so much. Definitely mental health over everything else. So another question is, what are some tips to be able to apply for internships in other places? This person tried to get an internship in Germany, but it got canceled by the pandemic.
Yeah, well, the pandemic really ruined our life, all of us. But
Yeah, for sure.
again, I would say internships. So try to meet. It doesn't have to be a direct internship. I would tell you this thing I always do. I would go, let's say you want I don't know, an internship in ENT. So go to your professor, a professor you know who's close to you and who's willing to speak, and tell them, oh, Professor, I need this in this country. Maybe he wouldn't know someone directly, but he might know someone who would know someone. So it really matters. I know it might seem like, ugh, that's not professional, but this is how it goes. Like if you know someone who knows someone, it might work. It might not work, but it might work. And never like go for one internship, meaning if you want to apply for somewhere, try to knock so many doors before you settle for one door, because from 10 doors maybe only one will answer. But uh do not give it up, like keep trying. And for this person who applied and got canceled because of pandemic, I mean, it wasn't that you did not get accepted, you actually got accepted. So maybe now if you go and contact them and tell them you got accepted, but it got canceled by the pandemic, maybe now they will take you. You don't know. You don't know till you try. So yeah, your relationships really matter. And like for example, what shall I call it? If you know a friend who went there, if you know a doctor, really famous one, try to email them on private emails. Sometimes private emails really pay off. Like, yeah, you don't have to go through the normal strategies. Who says that this is the normal?
I love that. Honestly, thank you so much. I believe you're giving us wonderful advice, and yeah, I think
Hopefully.
it's absolutely great. Thank you so much.
You're welcome.
um,
Hopefully it is.
so another question is, how helpful was being able to speak other languages in the medical field? Since you did mention you speak 3 languages.
Yeah, when I first came to Turkey, I did not speak Turkish, although I'm half Turkish, but I never lived in Turkey, so I did not know the language. I knew English and Arabic. Honestly, it was really hard in the beginning since Turkish people do not speak any of the languages. But now looking at it, after I started to speak 3 languages, like now when I'm in the, like it was my first day in Agile, in like emergency department, sorry. And I already helped with like 3 patients. No one else was able to help because they don't speak Turkish and the doctors do not speak Arabic, but I do. So your language always matter. They always help. I believe that a doctor should be able to speak as much languages as they can. I'm trying to learn Spanish now, but God knows it's really hard to learn it by yourself. But Yeah, learning languages really helps, since it's like, this is my personal belief. It's really nice when the patient comes to you and then you realize they realize that you are really close to them and closer than any other one. I have this ophthalmologist teacher in our school. He speaks Turkish, obviously, but he has Kurdish as well, and he speaks a little bit of Arabic. Like, he speaks it. He does not write it, but he speaks it. So when my family goes there, they get like really relaxed and comfortable with it, because this guy actually feels like a family for them. I know they say that you don't have to go close to your patient, but there is a really nice thing to do if you act close. It's not lie. It's, you're professional, but you make them feel as if you are a family member. It's a very helpful thing to build a relationship with the patients. It makes them easier to speak to you, easier to open up. So yeah, I actually believe like languages can be a deal breaker.
Thank you. Yeah, I also believe that learning as many, I'm sorry, languages as possible, it's absolutely great. I've heard of many stories. For example, in the United States, there's a lot of Spanish speaking people. And when doctors are able to speak Spanish to these people, they feel so safe, because sometimes during the translation process, like a lot of information can be lost or at least misunderstood. So when you know someone that fully understands you, I don't know, I think it's a nice feeling, it's a nice feeling of safety
I
with.
would say that, sorry, I'm sorry for
Oh, don't worry.
contributing you, but I would say that one of the most important thing that, for example, in Turkey, a lot of people who works as translator in hospitals, they are not actually professional health translators, so they do not know like medical terms, and that makes a lot of disastrous mistakes.
Yeah, for sure, there's a lot of misunderstanding, so yeah, I definitely agree with you. So this person says, I know there's a lot of competition during med school, but is there also competition where you are already a doctor?
Let
Face
me
competition?
say, that I wouldn't know exactly, since I just graduated. Like, it's been like few months. So maybe in the future, you already guys know my blog. So maybe in the future you can pop up and ask me this question again. Maybe by that time I would have an answer.
Okay, thank you so much. Okay, so another question over here is, our audience member says, I am from Mexico and I will take the USMLE in a year. How has the change of studying in a language and working in how has it changed, your perspectives of working in one language and having to do this in another one?
Oh, I'm not sure if I got the question. Do they mean that they are working in the hospital with Mexican language and Spanish language, sorry, and then um, studying in English? Is that what they mean?
Yes, I believe so.
Okay. I would say that it doesn't for me, it doesn't really makes a lot of problems, since starting third year in my fourth year in my school, we started to, the slides itself were in English and the written exams was in English, but the speaking, like the explaining language and patients and the oral were like almost 90% Turkish. So in the beginning, it might be hard and overwhelming, but if you are strong in both languages, then I believe there wouldn't be a lot of problems, especially that it's not the same when you're studying in Arabic and sorry, working in Arabic and studying in English, since the terminology between Arabic and English are quite different. Like, they do not speak the same. But for example, between Turkish and English, they both in medicine use Latin, like as this scientific language. So the terminology itself is not that much of a difference. So I believe if you are strong in both languages, it would be it would be a challenge, but not quite a challenge.
Okay, thank you so much. So another question we have over here is regarding your high school experience, in order to get to your medical experience. So how was your experience in high school? How did you prepare for medical school and all of this journey during high school?
Well, first of all, I'm graduated from Saudi Arabia. In Saudi Arabia, we do not get them, how should I say, the talent support that we get in other countries. So it's more like a basic, normal teaching style, you know, like the old school. But me, I was the school sweetheart. So I was the favorite kid in with for the teachers. I was so polite that all the girls would be like, they would count me as friend, even if they will even if they are willing to bully me. So in the beginning, there was some bullying, but later on, when they knew that I play taekwondo, they were like, kind of, oh no, we do not want to do that with her. And I was like the teacher's favorite student. I wasn't the best for the administration, but the one of the headmasters of the school was quite a fan of me. She actually really believed in me, and that made me really kind of supported. Like I remember even we had a fight with, we were on a trip, school trip, and then we had a fight with another school. But since I said that the other school, they started it and they did something bad to us, all the school believed me, although there was like not the exact fact, you know, like well, if Nasreen said that we are willing to fight, we're fighting, you know. So yeah, I was this student, and I was the top of one of the top of my classes the whole time. I wouldn't say that Saudi Arabia was the hardest high school ever in terms of teaching, but it's not. They have a good curriculums. They just do not. They do not go through like, oh my God, we're gonna push you to the end. You know, they were like, if you want to become a doctor, be a doctor. If you don't want, whatever. And actually, that wasn't bad, since a lot of people in my class were like engineering, or they studied engineering or medicine or emergency medicine or dentistry in like in different countries. So yeah, this is how was my experience. It was quite okay. I was like popular. I had a lot of friends, especially in high school. Like before that, I didn't, but in high school, I was able to start to build up my kind of base of friends. So yeah, I believe it was not bad for me, but I know a lot of people like go through a lot in high school, and I really sorry for that. But like for me, it wasn't.
Okay, great. So another question, you already mentioned how you dealt with your anxiety and stress while being in medical school. But our audience members ask, how do you deal with anxiety while working in medicine already as a doctor?
Uh, okay, I actually seek it like medical support, so I take medication. I'm not gonna lie about it, and it's okay. As doctors, we really can deal with that, and especially that it's not a magical pill. We have to work with it. So I use a lot of stuff like writing, sport. It's one of the reasons why I do kickboxing now, because it's a de-stressing sport. um I try to do my best. It's hard, and it's not easy, but it's we can do it, we can make it. You know what, I always believe in this thing, make your you know how they say, keep your enemy close, keep your friend close, keep your enemy closer. I believe that it should be keep your friend close, keep your enemy closer, and keep your fans super super close. Each one of us has a lot of fans. Even if you're not an influencer, even if you do not have a blog, you have fans. You should just look around, and when you see these fans, you see how much they believe in you. You'll be like, if they do, why I don't? You
I
know,
like that.
it's
I like
hard,
that
but it's manageable. We can do it.
for sure. Thank you so much. I love that. Okay, so this is a question I was wondering. Did you do any type of research while being in med school? And if so, what kind of research? Okay.
Guilty of charge. Let's say that. Um, in first year, I tried to do a research on how Sufism. I don't know if you know what Sufism is.
No.
Okay, Sufism is a perspective of thought. It's a way of thinking that it's involved in all religions. So you can be a Muslim who's Sufi, or you can be Christian who's Sufi, you can be Sikh who's Sufi, it doesn't matter. It's a way of thinking, okay? It's really about how you do not really get connected in the materialistic lifestyle. It's more into how to go spiritual with like your God. Okay, so it was your relationship, the relationship between Sufism and medical ethics. And it was, sorry, medical ethics and culture. And it was kind of really interesting topic. I really liked it. I wrote a lot on it, but then it did not work out. First 3 years, I got a lot of bad experience with researchers. Like all the teachers I tried to do research with, I did not get any benefit with. In third year, I published one paper. It was called, what was it called? Intracranial hypertension, pseudotumor cerebri, and nerve 6 palsy. I published that paper as a second writer. And then after that, no, nothing. Like I try, but like I'm bad at. I become really since I had a lot of experience. So when I now go on and I want to do a research, I'll be like, oh, oops, I'm not gonna make it. I'm gonna fail. I'm gonna do stuff, and I'll be like so slow with it and so bad with it. I even tried to do a research with in oncology, and it didn't work since the case that we were working on was figure out that it was diagnosed differently, like incorrectly. My hospital, it's although we have a lot of professors who are good in pediatrics, but it's not quite the best center to make pediatrics researchers, since they are all like really old in the age, so they already have quite enough of a published. Like for example, this cardiologist was speaking about, she was like one of the first 40 cardiologists in pediatrics field in the whole Turkey. So it was like, yeah, whatever. I do not need it anymore, you know. And now I'm trying to work on researching gynecology. Let's cross finger and say maybe it work. Pray for me, guys. Please pray for me. Like, please.
For sure, doctor. Okay, so I do know that you mentioned that you were not yet a pediatrician, but there's a question regarding pediatrics over here. So the person asks, how do you go about educating parents and explaining to them what is the best for their child, and what kind of challenges do you face throughout this process, if any? I think we're having problems on our speaker's end. I will try contacting her.
Yeah,
Yes,
her internet might be down.
yeah, I do believe she may have had problems with her connection.
In case anyone's curious, I'm about to paste her abstract from PubMed. If you guys are curious, you can go down the rabbit hole on that one.
Thank you so much.
We'll wait a few moments to see if maybe she can be back for the end of the session. If not, I guess we'll start up with the wrap up.
She has arrived. So, Dr. Aldroubi, can you hear us?
Hello, can you hear me, guys?
Yes, we can hear you.
Sorry, guys, I got like we have a lot of rain, like it's a storm, and electricity went off. So there was a question you were asking. I'm so sorry. I would make sure
Absolutely.
to keep on as much as my internet package can give me.
Yeah, no
For sure.
problem. So Jesus
Don't
can
worry.
repeat the question he was asking.
Yeah, for
Yes.
sure. So you did mention that you were not yet a pediatrician, but that was one of your interests. So this person asks, how do you go about educating parents and explaining to them what is the best for the child, and what kind of challenges could you be facing throughout the process of educating parents?
Okay, I would go just about the things that I kind of read about and like my teachers mentioned. And it's about you have to make sure that the family actually knows that you really want the best for the family. You are not an enemy, you're just a friend who is trying to do the best. And one thing that it's not only about pediatrics, it's about all the fields. Try to make the patient, like the family in this case, involved in taking the decision. Respect them, respect their beliefs, respect the way they think, and then go from there in a way to show them that, okay, you are thinking this way, but what if something else is better? Try to become the guide of the situation, but not really like the bully of the situation. You get what I mean?
Okay, thank you so much. So another question regarding families and their beliefs, right? I think this one's a very interesting question. So there are some cultures and families in which there is an authoritarian philosophy in which the child's interests and desires are ignored. How do you go about talking to these families, or what would you recommend about the child's social and personal development?
I see. I would say that this is quite an interesting question, yet it's quite specialized question. So maybe I wouldn't be the best to speak about it, but I believe that we are going slower and slower into a society where where families actually are more educated about the fact that child health and interests are important. There was a study made, I actually heard about it the other day, about the fact of like in oncology cases of adolescents, where there was like a study that's made to actually discuss the topic. Does the mentioning the death scenario of their cases in early time is better, or is it worse? And what really came up with the study, although it was focused on more like on a white society, the studies showed that actually a lot of families did not know what the child actually want. And when the chance were giving for the family and the child to speak together about it, the results were better. Maybe if this was made in a different society or something like that, chances would change. But speaking in general, I would believe that we can, like, speaking can change a lot.
Okay, thank you so much. I definitely agree. Communication is an essential part of a family. So but for our last question, what qualities do you think you have developed as a result of becoming a doctor? I know you just recently graduated, but are there any specific qualities that you have developed so far in your medical career?
I would say yes, of course, we all develop stuff through the way. I would say I grow stronger, man. Yeah, I did. I did grow stronger. Like when I like compare myself now to the me 6 years ago, I would be really surprised of how much I evolved. Yeah, not only in terms of like strong personality, it's in terms of for example, how much I can deal with the other gender, since I came from Saudi Arabia, so we did not have a lot of contact with the other gender. And when I came here, I was really surprised that I was able in a short time to develop the capacity to deal with them. I was even with time I developed the ability to, although I was a speaker since I was a child, like even when I was in school, I was really surprised that when the society even got bigger, it did not like really evolve. It did not like it made me more scared or anything like that. It actually made my dreams get bigger. So yeah, I guess one of the really for sure fact about medicine, and not only medicine but any university, let's say life, is that we change. The change is the only unchangeable fact about it.
Thank you so much. I've loved this Q&A session. There's a lot of advice that we can take from it. At least I know that I can. So once again, thank you so much for joining us, Dr. Aldroubi. Now I'll be presenting the slides for our wrap up, since we are done with this session, or at least almost done. I want to.
Before we start this, I just want to say thank you very, very much for this opportunity. I'm really glad to do that. I'm really honored, actually. Thanks a lot. I wish we can deal together anytime soon. And yeah, thank you for the experience.
For sure. Thank you so much for joining us, Doctor.
And I want to say thank you for the efforts you're doing, guys. You're doing a great job. Keep up. And I am proud that you are out there.
Thank you so much. So now I want to invite you all to reflect on this session today with these 3 questions that we have over here. So what brought you to this session today? What are 3 major takeaways that you got from it? I know that at least I got a couple things to take from this session today. And what do you want to learn more about? You can definitely, we encourage you to answer these questions. Maybe write them up, your answers, or just answer them in your mind. It's fine, whatever you feel comfortable with. But we do want to invite you all to reflect a little. And even though it is not required, if you do write a reflection, we encourage you to submit it to our website for publication, for recognition of your hard work, and to enhance future applications as well. I would like to mention once again, as my partner Muntaha mentioned, that Pre-Health Shadowing is launching a research program that will allow students to connect with principal investigators as they conduct research and in various topics, fields, and locations. And this program we want to highlight that is 100% remote, which means that you have the power to connect with anyone. This is an 8-week program that will begin on June 21st. And for more information, please fill out the interest form sent in the chat, and we will get back to you as soon as possible with additional details. If you want to learn more about pre-health shadowing and how to get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion as well. We are also accepting team members' applications if you want to take on a more active role in PHS to lead projects and initiatives to be up here with us. Once again, we are humbly asking that if you are financially able to donate, that you please consider doing so. It costs a lot to keep our program up and running and free to all of you. So if you're someone who can afford to, or if you know someone else who can, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask you to spread the word about the pre-health shadowing to reach as many students as possible. Now, for the part we have all been waiting for, earning a digital certificate for the virtual shadowing hours from this session today. The first thing you're gonna do is go onto our website and find our professionals course pages. Here you can take our quick 10-question multiple choice quiz based on the content from this session today. You will have 30 minutes per attempt to earn 70% or higher to get your certificate. We do know, of course, that sometimes technology can be difficult. And for this reason, we allow up to 2 attempts to take the assessment. But if you run into any difficulties, please do not hesitate to contact us. To ensure that our website does not crash from a high influx of students, we do recommend waiting about 30 minutes to an hour after the session to take the quiz, which will be open, I want to highlight, indefinitely. Once you have passed, you can click the Finish Course button at the bottom of the professionals page, and there you can download your certificate verifying your shadowing hours. If unfortunately you missed part of this session or you want to go back and view other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings. You can also find them via the professional pages on our website and take the post-shadowing assessments for these as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events. We are currently booked every single weekday through June for virtual shadowing sessions, so we definitely hope to see you guys over there. Once again, I want to thank you all for joining us today, and please do stick around if you have any questions, and myself and other team members will definitely be happy to answer them. The shadowing session is officially over, and I invite you all to log off. Have a wonderful day, evening, or night.